Spring is the perfect time for a reset. Okay, maybe it's not spring yet, but we're pretty close, right? Let's plan ahead. Today, we're doing a simple spring cleaning for your oral healthcare routine. Not necessarily the act of brushing and flossing, but most about the stuff that goes in your mouth. When we think of spring cleaning, we think of opening the windows, moving the furniture and vacuuming underneath, dust the fans, clear the clutter, the obvious stuff. There's one place that most people forget to clean out almost every year: their oral care cabinet and drawers. Hey Verse TV, my name is Kelly. I'm a registered dental hygienist and a proud Verse ambassador. Today, we are doing a very specific kind of spring cleaning. A simple, realistic checklist that makes you want to just get rid of all the stuff that needs to go. Refresh what you use daily, and then start a healthier, brighter smile. This is not about buying a million new things. It's about making sure what you already have is clean and effective, and it's actually helping and not hurting your oral health. Let's just start with an easy win. Expiration dates. Most toothpaste expire 2 years from the manufacturing date. This is because fluoride and the minerals inside the toothpaste become less effective the older they are. And the texture and the taste can change over time. It just is a bummer. Things are not meant to last forever. And if you can't read the expiration date, it's probably time to toss it. And I know that from experience. And when it comes to mouthwash, shelf life still matters, especially for the fluoride and the antiseptic properties in the formula. Improper storage is very important too. We want to stay away from heat and sunlight. This will shorten the effectiveness. If it smells off and it's cloudy, toss the mouthwash. Now let's talk about topical fluorides and gels. This is usually a prescription formula that your dentist gave you because you're more cavity prone or you get cavities easily. Or if you're an ortho, that just increase your risk of getting a cavity. If those are expired, they're not going to be helping to protect your teeth from cavities. We do not want a false sense of protection and it's just not doing its job. So, quick little recap: if it's expired, it smells funky, or just looks kind of separated, let's toss it. Next, tool replacement checklist. I'm going to talk about the tools we stretch way longer to replace than what we should. Be honest with me, when was the last time you changed your toothbrush head? If you use a manual toothbrush, you should replace it every 3 months. An electric toothbrush head, pop it off, replace it every 3 months. I can't stress this enough. Even sooner you should replace it if the bristles look frayed because you're a hard scrubber, or if you've been sick. If your bristles are worn down, they're not going to remove as much plaque and bacteria from your mouth, and it's going to irritate your gums. Now let's talk about floss. Floss picks specifically are only supposed to be used one time. Don't keep it in your car just in case you have a little bit of food in between your teeth when you are driving. Single use. I'm also kind of saying this from experience. I'm sorry. I'm human. This is good stuff for me too. If your floss case is a reusable one, like mine, make sure we're wiping it down. You don't see any gunk in the creases. Store it in a dry area, and when you're on the go, I know I love to throw my floss in a purse with tons of stuff in it that can be kind of icky. Maybe try and put it in a small zip area that your purse has. Moving on to deep cleaning your devices. There are actually a lot of things that we use in our mouths that we don't replace unless it's broken. First example, water flosser. You want to empty and dry the reservoir daily. Weekly, we want to fill up the tank with warm water and vinegar, or you could use mild soap. Shake it up and run it through the system. Then you want to rinse thoroughly and then run cold water through it a couple times. Things you want to watch out for are mineral buildup, cloudy tanks, and slimy residue. Big red flag there. Next, sonic toothbrush handles. You want to wipe these down weekly with mild soap and water. You also want to clean the charging base. The dust and the moisture just loves this spot. And make sure everything is dry before you reassemble everything. Next, retainers and mouth guards. You definitely want to rinse these daily if you're using them every single day. I wear my retainer every night still. You're welcome, Dr. Fuchs. I gently rinse mine in the morning time with just water and my toothbrush. Don't use toothpaste. They're a little bit too abrasive and they can scratch the surface of your retainer, and then more plaque and buildup can get stuck in those creases where it was scratched. Occasionally, you want to use a disinfecting soap, and never store it wet in a closed case. Okay, Kelly? Okay. Moving on to cabinet declutter. This is the step that a lot of people skip, but it's still really important. Medicine cabinets and then right underneath the sink drawers tend to build up a lot of warm moisture and bacteria, dust, all the ickies. Use a disinfectant wipe and just make sure everything looks nice and clean. Circling back, proper storage. Toothbrushes upright and uncovered. Separate brush heads so they do not touch. Avoid standing water, and make sure to keep your products sealed when they're not in use. And I'm talking to the person who can't find the cap to the toothpaste. There you have it, a few small updates. Tossing expired products, swapping out worn tools, and cleaning the places you store them. This can all make a big difference in how effective your oral care routine truly is. If this is just the reminder you needed, give this video a thumbs up. And tell me in the comments, what's the one thing you know in your bathroom right now that needs to be replaced? Don't forget to come back every Thursday to a new video. Bye guys!